Good morning, my lovely people. Let me start by welcoming you people to my YouTube channel, whereby we always give you educational bangers as usual. I always start by appreciating you people, because if it were not for you guys, this channel maybe it could not be where it is at the moment. It is all because of your support that I'm where I am at the moment. For the returning subscribers, I always appreciate you because of the support you are giving this channel, and any other person who is doing anything, however little it is, to push this channel ahead, feel appreciated. For the better part of last week, we have been discussing about biopsy. We have been discussing different types of biopsies: skin biopsy, bone marrow biopsy, and today we will be seeing what we call bone lesion biopsy. Bone lesion biopsy. And as we continue, guys, if you are there and you know that you have not subscribed, make sure you hit the subscription button, put the notification bell on, so that whenever I produce a video like this, YouTube will always automatically update you or notify you, and you'll never miss any of our videos or any of my content. Bone lesion biopsy. As the name indicates, it refers to a biopsy or taking a sample from the bone. So, bone lesion biopsy is a surgical procedure in which a doctor removes a sample of your bone tissue and sends it to the laboratory for testing. Bone lesion biopsy is a surgical procedure in which a doctor removes a sample of your bone tissue and sends it to a laboratory for testing. The test typically distinguishes between cancerous and non-cancerous bone tumors and diagnoses other bone abnormalities. As we said before in our discussion, we have two types of cancer. We have the benign and the malignant. And we said biopsies mostly identifies cancer cells. So cancer cells can also be in the bones. So that's why we are saying the test or the bone lesion biopsy typically distinguishes between cancerous and non-cancerous bone tumors and diagnoses other bone abnormalities. This procedure involves making a small incision or drilling into the bone and removing a sample of tissue from the lesion inside the bone. Remember, this lesion or this abnormality is inside the bone. So you don't have to take the sample from any bone, but you have to take it from the lesion itself. So this procedure involves making a small incision or drilling into the bone and removing a sample of tissue from the lesion inside the bone. What is a lesion? Maybe we are talking about something which we don't know. A lesion is an abnormality in the structure of the bone which may or may not be impact, which may or may not impact bone growth. Let me repeat this one. A lesion is an abnormality in the structure of the bone which may or may not impact bone growth. This means that a lesion may sometimes, maybe it may interfere with the bone growth, or it may not interfere with the bone growth. So either way, It can interfere or it cannot, maybe it cannot interfere with the bone growth. So, not all lesions are cancerous, and this is very important. Let me repeat this. A lesion is an abnormality in the structure of the bone which may or may not impact bone growth. So it may interfere or may not interfere with the bone growth. And very important, not all lesions are cancerous. So that means some of them may be cancerous, others may not be cancerous. Why do I need a bone lesion biopsy? Or why is it done? This is a question we are asking ourselves. Why do I need a bone lesion biopsy? Your doctor may order a bone lesion biopsy if there are signs of abnormalities in your bones. Definitely, there must be an issue in your bone for a doctor to request or ask for a bone lesion biopsy. So your doctor may order a bone lesion biopsy if there are signs of abnormalities in your bones. This may show up on imaging scans such as X-rays or CT scans. These abnormalities may show up on imaging scans such as X-rays or CT scans. So when the doctor sees or diagnoses these abnormalities, for example in an X-ray or a CT scan, he or she may decide to go further to make more diagnosis or to rule out what is inside the tumor in your bone or the lesion. So, after seeing the lesion or the tumor or the abnormality in an X-ray, as we said, biopsies identify cancer cells in most cases. That's why all this may necessitate the doctor to decide on making a bone lesion biopsy. So, your doctor may order a bone lesion biopsy if there are signs of abnormalities in your bones. These show up on imaging scans such as X-rays or CT scans. A biopsy helps doctors determine if your bone lesions are the result of cancer, infection, or another condition. A biopsy helps your doctor determine if your bone lesions are as the result of cancer, infection, or another condition. So these lesions or these abnormalities may be as a result of cancer, infections, or another condition. And through biopsy, the doctor will identify the specific cause of this problem. So, what are the conditions associated with the bone tumor or lesions? Or conditions that can predispose one to getting a bone tumor or lesion? These conditions include the following. Number one, we have coccidiomycosis, which is a fungal infection. Coccidiomycosis, which is a fungal infection. We have also Ewing's sarcoma, which is a cancerous bone tumor that affects children. This mostly affects children. Ewing's sarcoma, cancerous bone tumor that affects the children. We have fibroma. Fibroma is a benign tumor. We have histoplasmosis, which is a fungal infection. Histoplasmosis, which is a fungal infection. We have multiple myeloma, which is cancer of the bone. Multiple myeloma, which is the cancer of the bone. Multiple myeloma is the cancer of bone marrow involving plasma cells. This is very important. Multiple myeloma is the cancer of bone marrow involving plasma cells. We have myobacterial infection, for example, in the cases of tuberculosis. myobacterial infection, cases of tuberculosis. We have osteoblastoma. Many may ask, can we have TB of the bone? Yes, we have TB of the bone. TB is not always affecting the lungs. It can also affect the the bones. That's why we have this multiple myeloma, which is a cancer of the bone marrow involving plasma cells. So myobacteria infection specifically is a TB affecting the bones, or TB of the bones. We have osteoblastoma, which is benign bone tumor. Osteoblastoma, which is benign bone tumor. We have osteoma, which is a benign bone tumor. We have osteomalacia. Osteomalacia, this is common because it involves softening of bones due to lack of vitamin D, and especially in diabetic patients. That's where mostly we get osteomalacia, which is the softening of bones due to lack of vitamin D. We have osteomyelitis, which is a bone infection. Osteomyelitis, which is a bone infection. This marks the end of our video today. Thank you for your time. Thank you for being with me. Thank you for the far you have taken this channel, and let's have a wonderful day ahead.